All right, so good evening, everybody. I know you've had a nice and informative session with Dr. Mala, who's given you a lot of tips about how to prepare for the USMLE examination. Just a little word from me. I think ultimately, after you've heard all this, this is one exam which is actually which is sort of worth it. You know, it's the life that you have thereafter that is definitely worth it, worth all the trouble that you go through. Now, I'm the physiology faculty here in DAMS, and my focus is I'm going to try and tell you what are the type of questions. I'll take one sample. I'll try and tell you what are the type of questions which are asked from physiology in USMLE. Right? So a lot of the questions which come in USMLE Step 1 from physiology, these are concept oriented. They are going to test how much, what is the depth of knowledge, how much have you understood that particular topic. They are, like Dr. Mala told you, they are system related questions. There may be an additional component of pharma or patho in the question, right? So let me try and show you a sample question. Let me just try and tell you what is the difference between the question which is asked in a PG entrance exam in India and what would be the same topic, and what is the kind of question which will be asked in USMLE Step 1. So let me take this first pehla slide. First slide. Okay. All right, so let's have a look at this graph here in front of you. Now, if you could see this here on a lot of questions from physiology are visual questions in the sense that they are based on graphs. And this is a graph which shows, study the graph. On the x-axis, you've got percentage of proximal tubule length, and on the y-axis, you have something called the TF by P ratio. Right, TF by P ratio. TF stands for tubular fluid, P stands for plasma. So tubular fluid by plasma ratio, and on the x-axis you've got the percentage of proximal tubule length or percentage of the PCT. Right, and you could see something. There is a line, a horizontal line at 1, and there are lines A and B which are more than 1, and there is a line D which shows you that the TF by P ratio drops sharply and is almost 0, right? So this is what this graph shows you here. Now let me try and tell you what is the type of a question which is asked in a PG entrance exam. Now PG entrance exam, in the Indian PG entrance exam, would be probably a simple one, a direct question which says, which line represents chloride? Is it A, B, C or D, right? The kind of question which I expect in Step 1, now have a look at this one. Read the question carefully. Physiologists are attempting to study the specifics of kidney function in humans. They begin by withdrawing samples from different segments of the nephron by using micropipettes and studying concentration of various solutes in these samples. They are able to measure the concentration of different solutes over the length of PCT, the tubular fluid by plasma ratio for different substances shown in the slide above. Which of the following substances are most likely to produce curves A and B respectively? And here are your options. You are given 5 options here and combination of 2 substances. So this is the kind of, and again, when you look at this question, it is going to test your concept, whether you've actually understood it, whether you have assimilated all the knowledge that has been that is there as far as this topic is concerned. So let's try and understand the theory behind this. Take note. Take note. Right. So let's try and understand the theory behind this. Yes. Now the when you look at the PCT, okay. Okay, so when you look at the PCT, the filtrate which is formed, the glomerular filtrate which is formed, this is isotonic with plasma. The glomerular filtrate is isotonic with plasma. This, when I say isotonic with plasma, what does it mean? It means basically the glomerular filtrate, this is nothing but glomerular filtrate. This is an ultrafiltrate of plasma. This is an ultrafiltrate. When I say ultrafiltrate of plasma, ultrafiltrate, this is basically plasma minus the plasma proteins. Absolutely the same composition as plasma minus the plasma proteins. So it's isotonic with plasma. Remember, plasma proteins have a very small contribution to plasma osmolality. Right? It is the mainly sodium and chloride which contribute maximum to plasma osmolality. And sodium and chloride are freely filtered. So the glomerular filtrate which is formed is isotonic with plasma. It's basically plasma minus the plasma proteins. Now, what are the changes which take place as this fluid passes through the PCT? Now, the glucose being a useful substance, so glucose is a substance which is freely filtered. Now, glucose, amino acids, these are useful substances. Both of these are reabsorbed to the tune of 100%. Towards the end of PCT, the glucose and amino acids present in the tubular fluid is 0. The complete glucose and amino acids are absorbed to the tune of 100%. Another substance which is absorbed in huge amounts is bicarbonate. Bicarbonate is absorbed to the tune of more than 90% here in the PCT. The electrolytes, sodium, potassium, chloride, the electrolytes, these are absorbed to the tune of 66% or 2/3. Water is also absorbed to the tune of 2/3 or 66%. Electrolytes and water to absorb to the same extent, right? So electrolytes, that is sodium, potassium, chloride, water, these are absorbed to the tune of 2/3, so that the fluid continues to remain isotonic by the end of PCT. Right? So this is your what is happening, what are the major changes which take place in the PCT. Glucose amino acid absorbed to the tune of 100%, bicarbonate more than 90%, electrolytes and water about 2/3 or 66%. So that fluid at the end of PCT continues to remain isotonic. Now, to discuss the TF by P ratio, when I said TF by P ratio, TF stands for tubular fluid by plasma ratio. So let's discuss this. Now, TF by P ratio for, let me take the first point, let's say for osmolality. TF by P ratio for osmolality at the end of PCT. At the end of PCT. Is it 1? Is it less than 1? Or is it more than 1? My first question, TF by P ratio for osmolality at the end of PCT. Is it 1? Is it less than 1? Or is it more than 1? See, what is the tubular fluid osmolality at the end of PCT? Isotonic with plasma. So if plasma osmolality is 300 or 290, it's approximately 290 milliosmoles per liter. So let's take it as if the tubular fluid plasma osmolality 300 milliosmoles or 290 milliosmoles per liter, TF is the tubular fluid osmolality is also the same, 300 or maybe 290 milliosmoles per liter. The TF by P ratio, tubular fluid osmolality divided by plasma osmolality, your ratio will be 1. Have you got my point? Right? So this is the fluid at the end of PCT is isotonic with plasma. Right? So tubular fluid by plasma ratio for osmolality will be 1. See, when I want to comment on tubular fluid by plasma ratio, I must look at the relative absorption of that substance and water. If the substance and water are absorbed to the same extent, then the tubular fluid concentration will be the same as the plasma concentration. Right? And my tubular fluid by plasma ratio will be 1. If the absorption of that substance is more than the absorption of water, see, I said you have to look at the relative absorption of the solute and water. Both are absorbed to the same extent. tubular fluid by plasma ratio is 1. If the substance is absorbed more than water, if the amount of the substance absorbed is more than that of water, now the tubular fluid concentration will decrease. Plasma concentration will increase. So tubular fluid by plasma ratio will become less than 1. But if the reabsorption of the substance is less than the reabsorption of water, now the tubular fluid concentration of that substance will increase. Plasma concentration will decrease. So the tubular fluid TF by P ratio will be more than 1. Let's take another example. Let's take the TF by P ratio for sodium. TF by P ratio for sodium at the end of PCT. Is it 1? Is it less than 1? Is it more than 1? Now, I've just discussed with you that the amount of sodium absorbed and the amount of water absorbed is almost the same, right? The tubular fluid concentration and the plasma concentration, therefore, will be the same. So, TF by P ratio for sodium, almost 1, right? Let's take tubular fluid by plasma ratio for bicarbonate. Is it 1? Is it less than 1? Is it more than 1? Right? Tubular fluid for, by plasma ratio for bicarbonate. And look at the relative absorption of bicarbonate and water. Bicarbonate, we've just discussed this here, bicarbonate is reabsorbed to the extent of, the amount of bicarbonate absorbed is more than 90% by the end of PCT, whereas the water absorption is 2/3 or 66%. Right? So tubular fluid concentration of bicarbonate will be lower than the plasma concentration of bicarbonate. So in other words, the TF by P ratio for bicarbonate will now become less than 1, right? You have to look at the relative absorption of the two substances, the solute and water. Both absorb to the same extent, TF by P ratio 1. If the absorption of the solute is more than the absorption of water, the TF concentration will decrease, TF by P ratio will become less than 1. Let's take another example. Let's take what is the TF by P ratio for glucose at the end of PCT. Is it 1? Is it less than 1? Is it more than 1? Or is it 0? Now by the end of PCT, 100% of glucose is absorbed. 100% of glucose is absorbed. There's no glucose present in the tubular fluid. So TF by P ratio now becomes 0 by the end of PCT. There is no glucose present in the tubular fluid. All of it has got absorbed in the PCT. Of course, this is under normal physiological conditions, right? So TF by P ratio for glucose is also less than 1 or 0 in this case. Let's take the example of TF by P ratio for chloride. For chloride, yes, TF by P ratio for chloride. Now chloride is, see, normally what do I expect? I expect the amount of sodium, the amount of chloride being absorbed will be equal to the amount of sodium being absorbed. See, chloride always follows sodium. So if sodium is absorbed to the extent of 2/3, chloride will also be absorbed to the extent of 2/3, and water is also absorbed to the extent of 2/3. They are linked with each other, sodium, chloride and water. Right? Now, but it's not that simple really. Now what happens here is, in the PCT there is another negative ion which is absorbed to a very large extent, and that is bicarbonate. Bicarbonate, we've already discussed, is absorbed to the tune of 90%. So the absorption of chloride now lags behind the absorption of sodium. So what's going to happen now? See, normally what do we expect? We expected that the amount of chloride absorbed will be equal to the amount of sodium absorbed, which will be equal to the amount of, and the amount of water absorbed will also be equal to this, right? But what has happened in the PCT is there is another negative ion which is absorbed to a very large extent in the PCT, and that is bicarbonate. Chloride absorption now sort of lags behind the absorption of sodium. So now the TF by P ratio for chloride at the end of PCT will be 1 less than 1 or more than 1. It now becomes slightly more than 1 because the tubular fluid concentration now increases. It is in fact now approximately 1.1 or maybe even 1.2. The amount of chloride absorbed in the PCT lags behind the amount of sodium absorbed, right? And the reason for that is the absorption of very large quantities of bicarbonate in the PCT. So the TF by P ratio, now the tubular fluid concentration becomes slightly more for chloride. So tubular fluid concentration, TF by P ratio now becomes more than 1. Another example, TF by P ratio for inulin. Now inulin is a substance which is freely filtered, not reabsorbed, not secreted. TF by P ratio for inulin, is it 1 less than 1 or more than 1? So let's try and understand this now. Inulin is a substance which is not going to be reabsorbed or secreted in the PCT, right? Inulin is not getting reabsorbed, but water is getting reabsorbed. So what is going to happen to the concentration of inulin at the end of PCT? This increases, right? Why does it increase? Again, I said inulin is a freely filtered substance. It is not reabsorbed, not secreted in the PCT. In fact, throughout the nephron, it is not reabsorbed. It is neither reabsorbed nor secreted. But water is getting reabsorbed in the PCT. In fact, 2/3 of the filtered water is getting reabsorbed in the PCT. So the concentration of inulin in the PCT now starts rising. So by the end of PCT, the TF by P ratio now becomes more than 1, right? More than 1. So you've had a look at the TF by P ratios for different substances. Again, to repeat, if the solute and water are reabsorbed to the same extent, TF by P ratio is 1. If the absorption of the solute is more than the absorption of water, tubular fluid concentration will decrease, plasma concentration will increase, TF by P ratio will become less than 1. If the absorption of the solute is less than the absorption of water, the tubular fluid concentration will now increase, plasma concentration will decrease, so tubular fluid by plasma ratio will be more than 1, right? Now let's go back to the question which I was trying to ask you. Okay, so this was the graph here, right? This is the graph here. So you've got these, you've got line C, which is at a TF by P ratio 1. So which are the substances which are more likely to have a TF by P ratio? I've just discussed with you osmolality, even sodium, TF by P ratio of approximately 1. A substance whose TF by P ratio is more than 1, right, where the reabsorption of the substance is, or of the solute, is less than the absorption of water. So for example, chloride, for example, inulin, right? Then a substance which is reabsorbed more than, whose reabsorption is more than the absorption of water, the TF by P ratio will be less than 1. So the line will be below C. In that case, it could be glucose, it could be bicarbonate, yes? So this is, now this was a question which is asked in the PG entrance. It says, which line represents chloride? A direct question, which is not difficult at all. Which is the one which represents chloride? My answer would be B, right? Let's see this. But let's now look at the USMLE pattern of question, which will be asked from the same topic. Now this says, which of the following substances are more likely to produce curves A and B? So you have to look at two substances, which is giving you A and B. And if you remember, A and B were both, A and B are both with TF by P ratios more than 1, right? TF by P ratio is more than 1. So let's see this. And if you look at curve A, very large increase in TF by P ratio. This substance is probably inulin, right? Very large increase. Because remember, inulin is a substance which is not reabsorbed at all, but water is getting reabsorbed. So there will be a maximum rise in the concentration of inulin along the length of the PCT. So by the end of PCT, tubular fluid concentration of inulin will be the maximum, right? So let's see this here. You've got an option here, inulin and chloride. That seems the best answer. Inulin and chloride, right? So this is the kind of difference in the pattern of the questions asked in the Indian PG entrance and the USMLE. USMLE, again to reiterate, needs as very concept oriented. You need to have a thorough understanding of the concept. You need to, so anything which can be, if you're clear in your concepts, and that is what we're going to focus on as far as dams is concerned. We are going to help you with building up your concept so that, and expose you to as many questions as possible on the USMLE pattern so that you do not have any difficulty in attempting physiology questions and the other subjects as well, right? Okay. All right, I'm going to hand over now to Dr. Sumer Sethi. I don't think he needs any introduction. He's a very well-known figure in the medical fraternity. He is the director of dams, and it is under his guidance that the USMLE program is, the USMLE dams, the dams USMLE edge is taking off. He'll be talking to you a little more, right? And the students who are here for the pre-foundation class, we'll start at 5 o'clock. Okay, thank you.